Hello, everybody. My name is Kelly Higgins. I am the Executive Director for the Autism Community Connection. Thank you for joining us. I have Kirsten Vincent with us. She is here to talk to us about the UnitedHealthcare Community Plan. Kirsten, thank you so much for joining us.
Thank you for having me. All right, well, as Kelly mentioned, I am with UnitedHealthcare Community Plan. I'm the Community Relations Specialist, and I cover several counties, including Johnson. And this is a program specifically for individuals with disabilities, but I will get into more of those details here soon. So who we are. So where does community and state fit in? UnitedHealthcare is devised into two different groups, UnitedHealthcare and Optum. So Optum is more along the behavioral health side. And we have our community and state, which is myself, our Medicare plans, global, and then UnitedHealthcare individual commercial plans, which some of you may have. So our mission is to help people live healthier lives and help make the health system work better for everyone, including those with disabilities. Being our vision is to be the most trusted name in healthcare, and our consumers deliver simplicity and earn trust, and our community care system be a catalyst for person-centered, community-based health transformation. Another great community-based organization would be Autism Community Connection. So great to have them be a partner with us as well as our state partners.
Thank you. We appreciate that.
What is Medicaid? So Medicaid provides health insurance coverage to people who may be experiencing low incomes, people with disabilities, and people who are older. Most Medicaid programs cover hospital stays, doctor visits, care for expecting mothers, shots for children, tests, and x-rays. Most states use managed care entities such as UnitedHealthcare. The one that I will talk about later, which is Hoosier Care Connect, is also covered by Anthem and MHS. So you may have come across those names either when completing applications for Medicaid or when being able to choose them as well. We're there to help the health of populations by partnering directly with local providers. So that'd be your doctors, dentists, and community organizations. So again, ACC, to address the social needs and health needs of individuals and families. So there are 77.3 million Americans on Medicaid, and it is the largest health insurance program in the nation. And it also covers health for half of the children in America. So this is a little map that shows where we're all at and the specific populations that we cover. So there's a lot of acronyms on there, so I won't cover too much of those, but obviously we are new to Indiana and we are specifically for the age, blind, and disabled population. So here is the actual community plan. So Hoosier Care Connect, roughly 96,901. We're up to about 100,000. Hoosiers would qualify in Indiana for this. So this includes individuals who are blind or have a disability or are over age 65 but not on Medicare for whatever reason, or DCS youth who have chosen to be in managed care. So that also includes wards of the state as well as foster care children. Like I said, we are up to a higher percentage, and that can just depend on different life experiences. And if someone does have a disability or gets diagnosed with that disability, they would be in that same bracket. So FSSA contracts with the MCEs, or managed care entities, that I mentioned before, and those ones are listed. And as we're growing, and this is a little outdated as we're trying to be more updated with the numbers, but they change monthly. So we're looking at about 5,300 right now, and there's the open enrollment is different for this one too. So I'll get into that in a bit. But the managed care entity health plans with physical locations in Indiana. So contracted for 4 years plus 2 optional 1-year renewals for 6 years. Chosen through Indiana Department of Administration procurement process. So that is each company goes for whatever Medicaid option that they want to, and then they are able to be represented in that. So these facts are a little bit less fun than the actual information here, but they do just inform those that you do have options, and it doesn't matter who you choose. It's just trying to provide the best option for what makes you the most comfortable. So these are the priorities, and this is across the board for all of the MCEs and any of your Medicaid providers. Should you have a Medicaid provider, specifically Hoosier Care Connect, so completing those health needs screeners for new members, and which goes back and identifies some of those health problems, issues. Maybe there's a disability, or there's some mental health needs, or some of the social determinants of health, such as housing, transportation, and food access. Completion of a comprehensive health needs assessment, follow up after hospitalization for mental illness or between 7 and 30 days. So if a kiddo is hospitalized for having some type of health issue, or I'm sorry, for having some type of mental health issue, making sure that they are going to see a physician, or whether that be a mental health provider or their PCP, to make sure that they are having that follow-up. Annual dental visits, adult preventive care, well care for children, and tobacco cessation, which is across the board. So these are just our contact information, provider advocates, and this I'll get into a little bit later, but these are providers being able to reach out to someone should they have a problem. If you were to go to the doctor and you found out you weren't covered there, that provider would be able to contact their provider advocate and see whether or not they're paneled or what their paneling is looking like to be able to accept your insurance. And that goes for not those specific names, but that does go for the other Anthem and MHS providers too.
For the behavioral health, is that the ones that work with families who are doing ABA therapy?
It depends, but primarily, yes. Are you referring to the Optum one?
Yes.
Yes, so that it would look different on the insurance card.
Okay.
So the role of the community relations specialist, which is myself, is to partner with community agencies and health centers to understand the health needs in the community and collaborate on wellness activities. So I have been able to attend several events that ACC has hosted, as well as the Disabilities Resource Fair last year in Johnson County, which would have been a great event. It was just monsooning, as it just chooses to.
Yes, it was.
It was a little rough out there, but always looking to add those back in and just, be a part of the community and share that there are resources out there. I also participate in community health fairs and present this information. So just making community members as well as community resources aware that this option is out there specifically for individuals with disabilities, to make sure that they have the care that they need. So I also provide on-site member education in the community. So this is kind of similar to what that would be, attend coalition meetings and just kind of represent the disabled population. And my regions are 3, 4, and 5. Obviously Johnson is up in 3. So the value added benefits. These are kind of incentives that you get when you enroll with UnitedHealthcare Community Plan. Each MCE or managed care entity has their own, and we try and make them more applicable to families and individuals with disabilities, or that are in the foster care population, or that aged population that I mentioned before, to try and help reduce the barriers to getting care. So member rewards and preventive health. An individual, so this is once you are enrolled and become a member, you get a $25 gift card for completing needed preventive services, including HbA1c screenings for diabetics, annual well child visits, and adolescent well care ages 3 through 20. So particularly with foster care, just trying to stay on top of those and be preventive and, help reduce things from happening in the future by identifying if there are any health issues early on. Lead screening in children is a huge one, and annual dental visits. So that includes all members getting a $25 gift card for completing those. And the program is by member invitation only. So the rewards are tracked and redeemed through the portal that you complete once you are enrolled as a member. The Healthy First Steps program is a maternal health program, and it's available to any currently pregnant member. There aren't as many within this Medicaid option. They usually fall under the Healthy Indiana Plan or HIP. And for this, though, if you are on it, you get a $15 gift card for enrolling into the program, a $25 gift card for obtaining timely postpartum care, as well as periodic gifts to support mom, baby, and that includes like digital thermometer, home safety kit, books, gift cards, and more, and community baby showers. So those happened not as frequently due to COVID, but they are out there in several of the counties in the surrounding areas within Johnson too, and the tobacco cessation support through the Indiana Quick Line. So the nurse line in this, if a child that does have autism is, and we'll get to that in a bit, but is in the process of either waiting for a waiver or maybe has not received a full diagnosis yet, or has a different disability, the nurse line is available 24/7, 365 days per year. So this is to try and help reduce emergency room visits. And so a member can call, or a parent of a member, if they're under 18, can call this nurse line and speak to a nurse directly. So give them what's going on, or give them updates on what's going on, and receive advice on what they can do for it. So based on the recommendation of the nurse, if they say, okay, this is fine, you can wait until either an urgent care is open or contact your primary care provider. Or you can also, if needed, go to the emergency room based on that recommendation. So if that is the case, then that $10 copay is waived. So the Customer Engagement Center, this is something that I do like to talk to people most about, because this can be helpful for anyone, whether that be Medicaid or traditional insurance, and also Medicare too, but specifically for Hoosier Care Connect and the UnitedHealthcare Community Plan, we provide member service advocates who provide ongoing support. So after you receive your Hoosier Care Connect card, there's a number on it, and you call that number. So the first person to answer is the person who you will then be connected to for the duration of your time as a member, which is great. So you don't have to talk to several different people trying to get an answer, whether that be for an insurance claim or trying to figure out who your primary care physician is in your network, or who you can go to for the dentist. You're always going to be speaking to the same person. And then they also have their number will then be given to you once you do get assigned to that person. And they are available Monday through Friday, 8 a.m. to 8 p.m. So not only can they help with those healthcare questions that I mentioned earlier, they also understand the Hoosier Care Connect program very well. So they know what things are covered, and they know what things that you could be getting, maybe you're not getting, depending on your provider, because healthcare and health insurance can be pretty complicated. They can help find and locate a doctor, dentist, or eye doctor, explain benefits and coverage, talk about special programs that are available, such as the MOMS one that I mentioned previously, find resources to help with other problems. So if you're in need of food access, housing, transportation, employment, if you aren't safe and you need somewhere to go, or education options. They also provide information on state programs. So they're very well versed in the Supplemental Nutrition Assistance Program, or SNAP, as well as WIC, or the Women, Infants, and Children benefits too. They also help update personal contact information like address, phone number, email, So if any of those things change and you aren't familiar with how to complete it on your own in the member portal, then you can call your member service advocate and they can help you out with that. They also collect preferred methods of communication. So if you do have a disability, if you are in need of some type of assistance due to hearing or vision, so they can help accommodate those, and whether that be email, phone, or mail. They also resolve issues with providers. So again, going back to that advocacy, they are there to help you through the healthcare process and help navigate the very complex system. So if you have any questions about a provider, or if you feel like something isn't right and you did receive a bill, they can help contact and advocate on your behalf, including for specialty care. So if there was something within that lines, as well as behavioral health. And they also can assist with challenges due to prior approval, or so if you need one of those, or payment for services and care delivery. So one of the great things that we also do is work with the Indiana Department of Workforce Development and the Adult Education Program. And we help provide free support, including virtual or on-site courses, study materials, and mock exams. UHC will provide a voucher once, so that just the one-time sitting for the exam, that is $115 value, and that can be completed at any one of these 72 Indiana locations, as well as the referring members to the HSE coordinator if a member does have special needs. So really trying to be accommodating if there is a disability. And these can be discussed so that the member can be matched the most appropriate resources in that member's area, and they're able to complete the exam on their needs basis.
That's really good to know.
Yes, and I think that is what prevents people from doing that at times, particularly with special education.
Yeah.
And not having those accommodations is a huge barrier in completing that. And one of the great things too is providing a $100 annual reimbursement that is available to all members through alternative healing, which is great because sometimes some physicians recommend things that not everyone who is on Medicaid can, afford, or if they are in need of something else that would be beneficial based on some recommendations from a provider. So herbal medications or herbal remedies, as well as vitamins and minerals, therapeutic massage, and acupuncture. So if there is something that is recommended by a physician and the person is willing to use that, so if that's acupuncture, maybe to help reduce stress or increase blood flow, they can go there, and you won't have the money prior to that. You can submit $100 reimbursement of that, whatever the expense is, so up to $100 to your member services advocate, and they can also help you through those steps in completing that. And that is at least once a year. So just something to be aware of or take advantage of too. Also, low-cost internet is another great benefit. So this is not fully through UnitedHealthcare, but we do have a partnership with AT&T and Xfinity, and they are offering members of UnitedHealthcare Community Plan $5 to $10 month option. So they have to have these different requirements to be able to receive it. So for AT&T, they must have SNAP, SSI, have a child in Head Start, or for your reduced lunch program. Xfinity, the member must be eligible for public assistance programs such as National School Lunch Program, Housing Assistance, Medicaid, SSI, etc. I also think I neglected to say at the beginning that if an individual has SSI, they also qualify for this. And one other thing that is not listed on here is that if for pregnant women, if they are receiving adequate prenatal care and going to the doctor during their pregnancy, and if they have a disability that prevents them from being able to leave, once they are home, during that time of their prenatal care, they can get connected to a care coordinator, and that care coordinator can help link them to a postpartum delivery for meals for 14 days. So at least one meal a day for those 14 days postpartum will be delivered through that care coordination to try and reduce some of those barriers too, including food access.
Can you explain how families who are not on the Medicaid waiver yet, or they're on Medicaid waiver, at what point do they get to pick UnitedHealthcare at that point? How does that work for them?
So if a individual does have a diagnosed disability and is income eligible for Medicaid, they will go through the application process. So generally, and this is something to just be aware of when applying for Medicaid, there are 3 different options. There's Hoosier Care Connect, which is the one that I just presented on, as well as Healthy Indiana Plan, which is the standard Medicaid plan, and Hoosier HealthWise, which is generally for children. So Hoosier Care Connect helps cover those added expenses that generally go if you go with having a disability, and just making sure that those items are covered. There's a list online that has everything that is covered through Hoosier Care Connect. It's all pretty standard. The incentives is really what varies from company to company. But during that application process, so if you complete it yourself or if you complete it with an insurance navigator, there's a question that says, do you have a disability? So if you have a diagnosed disability, you can put that on there. It does require more paperwork in order to show that, yes, this disability is there. And then once you get approved through that, you get a Hoosier Care Connect card, and it has the 3 options listed on there. And then you, on the back of your Hoosier Care Connect card, you have I'm not sure what the time frame is. I know it's a quick turnaround that you have to then choose who you would like to go through.
Very interesting.
Yes, it's quite an intense process, but all of health insurance is, but just making sure that there is, not one company that runs it all or is the only choice, so that people can find truly like what is most beneficial for them.
So what happens if you don't take that next step in choosing a healthcare, or if you have no idea who you're with? How do you contact? Do you just call the numbers on the back of the card to anybody?
Yes.
Or
yeah. So that on the back of the card, like the Hoosier Care Connect, when it has who is listed on there, so it has Anthem, MHS, and Hoosier Care Connect, and Hoosier Care Connect and UnitedHealthcare. And so you can call those to, go ahead and move forward with it. Or if you don't within that certain time frame, there's what's called auto assignment, and it just goes to kind of whoever's next in the route. And then during the redetermination period, you always have the opportunity to switch.
So my daughters are both on the family support waiver through Medicaid, and the process I went through them was several years ago. And to be honest, I have no idea who we're with. So I'm sure there's other families like me who have no clue. So I guess our next step would be to call the member services just to find out who we're with.
Yes.
If there's any additional.
Yeah, you could be missing out on stuff too.
Yeah.
Or just like knowing if there's something that is more applicable, or just making sure that you're going to, the doctors in your network or anything like that. Or if you, and I know Kelly, for you in particular, you are like a librarian, your knowledge of all the resources in the community. So you may not need those resources, but should you ever come across one that you may have needed or,
right,
do need now, they will probably be able to help access that too.
Do you think this is something that our case managers would know who we're with? Like if we're with, UnitedCare or MHS or Anthem?
They should. However, that's when it does get a little tricky, since this is one of the options prior to getting approved for the waiver. So in that kind of in between, if you
Okay.
are, applying for the waiver, you say you got a diagnosis of a disability and you qualify for Medicaid. So when it comes around for open enrollment or redetermination, you can contact an insurance navigator who can help, choose a better fit for you. So you are not stuck in one plan just because you're in it now. You always have especially if things change and you can qualify for something else, which, can be the case. Absolutely. So if that is the case, then enrolling in Hoosier Care Connect, and once you have that disability diagnosis, or like I mentioned, children in foster care or anyone that receives SSI, then if you're in the process of applying for the waiver, you still have this coverage until that point. And then once you get enrolled or not enrolled necessarily, but approved for the waiver and you begin receiving those services, you will go back to the standard Medicaid.
Yes, and that's where we're at. Like I said, it's been several years since I filled out the information. I'd be honest, I have no idea who I picked or choose. So that is a very good thing to know, that we can get that figured out. And we do have the options to switch, to other plans as well. So that's great.
Mm-hmm. Yes, and the ones that offer the standard Medicaid are Anthem, MHS, CareSource, and MDYs.
Good to know.
Yes.
All right.
And then ours is specific for Hoosier Care Connect. And then in terms of learning more about that and being able to ask questions, so your insurance provider, as well as or the person listed on your card, as well as your case manager, will be able to answer those more in-depth questions of, if these services were to stop for whatever reason, what would that look like? Because sometimes,
Right.
Things happen and that are out of other people's control, and trying to be preventive and what steps do I need to take in order for that to not be the case. And I know with COVID too, it has definitely impacted the timeliness of things. So if there is a need, and, just making sure that you have coverage in general, or if someone would qualify for Hoosier Care Connect and they don't have the waiver, or if they are in the process of waiting, but it's definitely lengthy, but always good to contact. And I know Covering Kids and Families, that covers all of Marion County, and they have locations all throughout Indiana. They are very well versed on everything, and they do a lot of that policy work too. So they're always advocating for more coverage and just trying to make sure that those that need it are covered.
That's great. Good to know. Well, thank you so much for doing all this great information. And I hope everyone, why don't you do you have a contact information that you want people to contact you at, or a phone number you want to share?
Yes, if anyone wants to reach out or has questions, even if it's not specifically for UnitedHealthcare, I will do my best to lead you the right direction. My email address is Kirsten, so KIERSTEN .Vincent, VINCENT @UHC.com, or you can always call me, and my number is 812-269-6407.
All right, Kirsten, thank you so much, and I hope you have a great night.
Thank you, and thank you for having me.